Hello, hi everyone. My name is Ezaldeen. I'm a core surgical trainee currently working in Derriford Hospital. Today I'm presenting two audits. First one is a bone health check audit for patients who sustained fragility fractures. I've done this audit last year when I was in a TNO placement. First of all, I just want to introduce, start with introduction. Fragility fractures is a low trauma fracture sustained from fall from standing height or less. And it's a very common presentation to orthopedics. Approximately, we have 1 in 2 women and 1 in 5 men will sustain 1 or more fragility fractures in their lifetime. So currently in the UK, according to the National Osteoporosis Guidelines groups, we have more than 550,000 new fragility fractures occur each year. And this costs the NHS around 4.7 billion per year. And the other significant of these fragility fractures is the implications on the patients. So we see that loss of independence is common following hip fractures, with only 52% living in their own home after 120 days, and 26% will die within 12 months of their fractures. And this is also according to the NOG. The other thing which is important, there's an evidence and the research showing that bone protecting medication can reduce the risk of fragility fractures. So we can reduce the incidence of these fractures if we could investigate and find out the patients who are at risk of having fragility fractures or having osteoporosis. The aim of this audit was to see if patients who attended a fracture clinic and who sustained fragility fractures have their bone health checked after the incident as per guidelines. So we use the post standards. All patients admitted having sustained a fragility fracture should have a bone health review, be investigated, and prescribed appropriate medication when indicated. We used our systems, ICM, to check bloods. We used PACS to review the scans if done. We use the nerve centers where the A&E document the presentations, also fracture clinic letters to see if there's any recommendation from the doctor to see the patient fracture clinic for any further investigations, and also EPMA to check the past medical history for the patients. We involved 56 patients who sustained fragility fractures who were seen between September and November 2023. Age group were above 50-year-old, but please keep in mind we can also involve other patients who are at risk. The current guidelines now to involve the patients who are above 50-year-old. However, patients with risk factors, even below this age, for example, patients who are taking steroids, on hormone replacement therapy, they also can be included. Mechanism of injury that we include for this patient is just falling from standing, which is by definition the fragility fracture. Majority of these patients were female. As you know, like female sex is one of the major risk factors for osteoporosis. These are the type fractures we found. So the most common one is the distal braided fractures, which accounts for 29 patients got braided fractures. Humerus, there were 16 patients, and also ankle, 6 patients, and other fractures like clavicular fracture, tibial fractures were found in the 5 patients. We found that unfortunately, only 14 patients had DIXA scans done after the injury, and 6 of them were found to have osteoporosis. 5 of them were found to have osteopenia, and 3 only got to normal scans. 32 patients haven't had any DIXA scans, never had DIXA scans either before or after the injury, and 10 patients had DIXA scans within 5 years prior to the injury. History of osteoporosis. The majority of patients were not known to have osteoporosis before the fractures, and account for 32 patients were not known to have osteoporosis. However, after we've done the scans, we found 6 of them found to have osteoporosis. 12 patients were already known to have osteoporosis, and 8 patients were known to have osteopenia, and the other 4 patients we didn't have access to their GP record. Bone protecting medication, the majority of patients were not taking any bone protecting medication. 10 patients were taking the bone protecting medication. 4 of them started after the injury. We said that we found 6 patients who had osteoporosis on DEXA scans. 4 of them were started on bone protecting medication, and 1 of them refused the treatment, and 1 of them we didn't have access to the medical record to see if started on bone protection medication or not. Also, bone profile check. We had only 7 patients who had bone health check after the injury. 2 of them were found to have vitamin D deficiency, and the majority of patients, 41 patients, haven't had any bone profile checked. These are also the supplements, vitamin D and calcium. The majority of patients were not taking any supplements, vitamin D or calcium, and there are few patients started after the injury. So this is the conclusion. 14 patients out of 56 patients had DEXA scans done after the injury, account only for 25%. 6 patients of them were found to have osteoporosis, and 5 patients have osteopenia, 3 patients have normal scans. 32 patients have never had DEXA scans. 10 patients had DEXA scans within 5 years prior to injury. Only 7 patients had bone profile checked after the injury, which accounts only for 17%. 2 of them were found to have vitamin D deficiency, and 5 of them will have normal bone profile. We found that only 2 patients from the 56 had recommendation to their GP to do further investigations for fragility fractures. And one interesting finding that we had a patient who had fragility fracture, distal fracture, September 2024. He had no workup, osteoporotic workup. Then he had another fall and sustained another humerus fracture in March 2024. Then they've done the DEXA scans, and he was found to have osteoporotic and also vitamin D deficiency, and he was started after the second fragility fracture. He was started on bone protecting medication. Recommendations: according to the national osteoporosis guidelines, patients who sustain a fragility fracture should have access to a fracture liaison service, which enables timely fracture and falls risk assessments, investigations, treatment, and monitoring. Unfortunately, we do not have this service in our hospital. And our current practice now in fracture clinic, some doctors requesting DEXA scans and GP to chase and act on the results. And however, the problem with this approach is some GPs were not happy to chase these investigations. So even if you request, you need to chase the scans. And also, it's not only DEXA scans that we need for these patients. It's a proper workup that we need to assess thyroid function, bone profile, and a lot of other things. So I had a chat with our orthogeriatric team, who advised to clearly write in the fracture clinic letters the nature of the fracture, mechanism of injury, and then recommendation to GP to do further investigation. So they advised not to request the scans if we are not chasing that and acting on the results. Thank you very much.